Hey everybody, it's Dr. Matt Bridges, facial plastic surgeon from Richmond, Virginia. I'm here with Franki, our Master Aesthetician, and we wanted to highlight a patient that we saw recently who originally came in to talk about facial rejuvenation. She was thinking maybe surgery of some sort, like a face or neck lift. As we always do, we went in to see the patient together and we give a comprehensive evaluation of her face, including skin, tissue volume, skin laxity, and then we come up with a plan for action for her. She had an event coming up pretty soon after we saw her, and so we had a little bit of a time crunch as to what to do, and so that can limit a little bit what we would do in terms of a big recovery from surgery or otherwise. So, the patient definitely had some laxity of the skin. We did talk about maybe doing surgery at some point, but we started first with volume loss in her face and wrinkles in the skin, sun damage. And so Franki can tell you kind of what we got into as far as that goes and what we ended up doing with her.
So typically they'll come in, they see Dr. Bridges and myself in the same day. We go through a thorough consultation, medical concerns, timing, their job, their lifestyle, budget. We go through all of those things in the consultation. I had this patient come in, I prepped her skin, we got her on some medical grade skincare with Zeo Skin Health. Prepped her skin for approximately 8 weeks. This is a very regimented routine that tells me that they're going to be great with their post-care if they can do their pre-care. Then we go ahead and schedule her procedure at that time. Usually patients are here for about 3 hours that day. We get them medicated with Dr. Bridges. He can go into a little bit of his procedure and then we bring them in and get started. And this is a procedure that we do together. We always collaborate different areas of the face and her concerns, making sure that she is comfortable. Patients typically don't feel anything during this procedure, so they are comfortable at all times. So right before the procedure, I take them in to see Dr. Bridges, and maybe you can tell them what we do in one of your rooms before the procedure.
Yeah, so we decided to do Sciton TRL laser deep resurfacing. Yeah, these procedures run very smoothly. We've tweaked the protocol and we've gotten it down pretty smooth nowadays. We typically prescribe a relaxation medication that the patient brings with them to surgery and takes when we're getting started. And then after the patient starts to feel a little relaxed, we go in and we do a full facial numbing, which involves nerve blocks. By that point, the patient's feeling very relaxed. We come into the laser room and the procedure takes usually about 45 minutes. And again, we do this because these patients are undergoing a pretty deep resurfacing, especially in certain areas where there are deep wrinkles. We go quite deep to the point where the skin is bleeding a little bit, so it's way down there under the wrinkles. After the procedure, Franki puts on a mask, and this patient in particular did very well with this, and we can show photos of what she looked like even after a week, which was pretty unbelievable. And we'll have maybe update videos in the future to show her far out from surgery.
The pictures that you'll see are her a week out. She was an excellent candidate. She was doing vinegar soaks every 3 to 4 hours. She bought additional post-procedure intense hydration masks that she was doing. She would ice. She stayed elevated, so she did all the right things. Aftercare is typically about a month. I tell patients they're not going to wear makeup, but they're doing vinegar soaks for about 10 days, then a gentle cleanse, and it is keeping a heavy occlusive on their skin the whole time. They're in touch with me. They come back in a week. I call them the next day. They see Dr. Bridges when they come in, and then ideally we like to see them at a 2-month mark and then again at a 6-month mark because their results just get better over time.
Yeah, and I'll point out this laser is pretty amazing. I mean, this is a one-shot thing. We do one procedure. The recovery is significant, but it's really worth it. I mean, this is a 8 to 10 year kind of laser, so there's not multiple treatments. It's one treatment. The results are quite dramatic. We have other before and after shots on the website that you can see that show just pretty unbelievable results, and it's very long lasting. It's also nice, especially like in this patient where she can recover from her laser resurfacing, her skin's a little tighter, it heals better, it has better collagen. So then if we go back and do a facelift or any other kind of facial plastic surgery, she'll heal better and have a nicer result. So it's another good advantage of it.
So we offer other modalities. It's a great bang for your buck. It is some time home. It is some downtime and recovery. But again, some patients want to go a little bit stronger. This is something one in every 8 to 10 years. Other lasers they could do 2 and 3 times a year. Yeah. If you're not sure what procedure is right for you, please come in, have a consultation. You can see myself, you can see Dr. Bridges. We are very hands-on with these procedures with your aftercare. And if this is something or you're not sure what the right procedure is for you, we would be happy to see you.
Yeah, check us out at MatthewBridgesMD.com.
Or on Instagram at MatthewBridgesMD.
There you go.